Ayomide here, and guess what? We're back for more incredible journeys into the lives of everyday heroes on the World Without People podcast. Dive into more vibrant stories, shared experiences, and mind blowing perspectives with me in season 2. New faces, new stories, but the same old vibe. So, whether you're a seasoned listener or just stumbling upon this oasis of humanity, welcome. Grab your favorite beverage and join the adventure. Let's celebrate the beauty of the world, one remarkable story at a time. Welcome, everyone, to another episode of The World Without People. My name is Ayomide. I am so excited to be here. I'm always excited, but I'm excited especially today because I have my first coworker. Yay, yay, yay. I feel like my universe is expanding and I really, really love it. But I'm so honored really to be here with Miss Tanisha Greene. And she has a very fascinating story and I cannot wait for you guys to hear it. Welcome, Tanisha.
Hi, thank you for having me. Is my story fascinating?
I think so, but maybe it's just the Nigerian in me because
Well,
I think
my career story is sort of fascinating, yes.
yes, and that's where I want us to start from. But I do want you to give a little bit of background because now you're a New Yorker, but you didn't
Yeah,
start out as a New Yorker. So I want you to go all the way back, and then we'll get to where you are now in your career, and
right.
then we'll go from there.
Okay, so yeah, I actually did start out as a New Yorker. I stayed in New York until the fourth or fifth grade.
Okay.
I was born in New York. My mom and my dad are both from New York. My grandmother was born in New York. My great grandparents came to Brooklyn from St. Louis, Missouri in like 1899 or 1900,
Okay.
the story goes. And so they came to Brooklyn, they bought a house. They had my grandmother and her siblings in Brooklyn, my mom, all her siblings, my granddad, all from Brooklyn. I actually was educated in middle school, what they call middle school in the United States, middle school, and or in the South they called it middle school. I guess in the North they called it junior high, and high school in Atlanta, in a suburb of Atlanta, Georgia.
Hmm.
Reason for that is that my stepdad, my mom and my stepdad married when I was like 2 or 3. They got together, and my stepdad had gotten a job down in Atlanta. My mom also had a sister who lived in Atlanta, in the Atlanta area, and was doing very well down there. And this was during a time when New York had like a fiscal crisis. The 80s were horrible, and so my mom was like, "We're moving to Atlanta." That's what we did. She had a good career in Atlanta. My stepdad had a good career in Atlanta. I had a great high school experience in Atlanta, but visiting New York every summer, every spring break, every Christmas. So I still had strong ties to Brooklyn, New York. And when I left high school in Atlanta, I always wanted to come back to New York. I never wanted to stay in the South.
Hmm.
Not sure why. I guess I was that New Yorker in me from a little girl. I just always wanted to come back north. I did go to college in Mississippi for a year, and I loved Jackson State University. A couple of the girls from my high school went to Jackson State University with me, and they did well there, but they were also originally from the South. I
Right.
wanted to be back in New York so bad, and I left after a year, came back to New York, and I was like, "Yep, this is the city I want to be in." And I do visit the South, and I love the South. I love Southern cities a lot, actually, for visiting. But something about New York is where I needed to be. So I ended up finishing up college here in New York. And I thought I was, back then, I thought I'm going to have a long career as an admin, right? Because that's what
Mm.
everybody did when I was younger. I will be 53 in 2 weeks, but when I was younger, there wasn't yay, there wasn't the BSN wasn't a thing. There was no
Mm.
bachelor's of science in nursing. It was like when you were a young lady, you went to school to be an admin. You went even
Mm.
for 4 years of college. There wasn't that big push for STEM, for particularly for Black girls. There just wasn't. It was like get your MBA or get your a degree in business administration and go on to get your MBA. But there wasn't a lot.
Mm.
Not saying that people didn't go into science and didn't want to be doctors and things like that, but there just wasn't a big push for girls,
Mm.
back then. And so I started in a career as an admin,
Mm.
and I did admin for some of everybody, like different companies. And then I finally found myself as an admin at MetLife, which was an insurance company. And my job was to be an admin in employee health. And
Mm.
one of the jobs that I had to do was convince employees. At the time, MetLife was not public. They didn't go public. They weren't trading. They weren't this corporation that was public. They were like this family-owned corporation. And the owner or the head of the corporation, the business before it went to corporation status, was heavy into blood donation. It was something personal for him, and we would have blood drives multiple times a year at all of the different offices in New York and in the Northeast, Connecticut, New Jersey. And one of my jobs was to handle logistics for that. And as I was handling that, I got really, really interested in blood donation.
Mm.
And, I started showing up at the blood drives, going around to people's desks, asking them to come to the blood drive. You get like, I don't know, a vacation day, half a vacation day, or something like that if you donated blood. So I
Right.
started researching why it's so important to donate blood. And one of the first things that I found out was that there's a lack of Black folks donating blood.
Mm.
And we need more Black people to donate blood just because of different antigens. And a lot of Black folks have, one of the number one reasons that we get blood transfusions is to treat sickle cell anemia. Not
Right.
the only reason, but one of the number one reasons. And, of course, you can get O negative in an emergency, but it's best after multiple transfusions to treat sickle cell crisis to get blood that is your type, not
Mhm.
the emergency type. And also
Mm.
to get it from someone who's close from your ethnic background, because they may have antigens that you have or an absence of antigens that some people have because of their ethnic designation, which is, African American or African or Africans in the diaspora,
Right.
people who have African ancestry in the diaspora. So that became my thing to go around and to get more Black employees to donate blood. That became
Right.
my like little story. I would go to their desk and say, you have to donate blood because of this is why it's so important. And because of that, I had started to get like really bored with my desk job. Like I couldn't wait for the blood drives to come around. You can't donate blood but every 6 weeks. So we would have it every 6 weeks in different locations because you can't wear out your donors, right? So I would become bored in between. So in between was the logistics. What day are they coming back? What conference room will they be in? Making sure everybody got their vacation day. But those were all like, admin stuff. I couldn't wait every 6 weeks for the blood drive to come up again. So I could be going around to people's desks, going to all the different floors, going to different departments, talking about how important it was to donate blood. And I think that's what really got me into this health education phase. And I
Mm.
became really unhappy with my job. And one day I was at a blood drive, making sure that, everyone has snacks, the tables were set up. I would really help out. I was hands on. I wouldn't just plan the blood drives and say, everybody go downstairs to the blood drive. I was really, really hands on with the setting up, working with the New York Blood Center to do this. And one day I asked, there was a RN at the blood drive. She was running the blood drive. I said, how do you get to do this? How, the phlebotomist who had the blood drive, she was like, you have to have a phlebotomy certificate. And I was like, I want to do this. She was like, no, you don't. Do you want to do this? I was like, yes, I do. I want to do this. And she said, well, as a matter of fact, we have a training coming up and we have a phlebotomy training coming up and we'll train folks on phlebotomy. And if you pass the 6 week training, it's a paid training. We got some funds from New York State to train folks. And if you pass the training, you can work for us.
Mm.
I said, I'll do it. I had never done anything medically in my life. I said, I'll do it. And I went back to my job and said, yeah, I'm resigning. I'm going to work for the New York Blood Center. And everyone laughed at me, including my own family. They were like, you're not going to be drawing blood. I was like, yes, I am. And I
Mm.
did the 6 weeks of training, became a phlebotomist, moved up at the blood center. I was doing whole blood donations and white cells and leukocyte, like literally doing apheresis procedures. Um,
Mm.
and that's when I had did that for a couple of years and I still loved it. I loved going to the different sites, going to different work sites. Even the city of New York used to have a big one for city employees. There was a police academy one. But one of my favorite things to do was to talk Black people into giving blood. Like when I would go, I wouldn't just draw the blood. I would just be educating the entire time. When my family was like, nope, it's time for you to go back to school. You need to be a nurse.
Yeah.
And
I want you to say how old you are at this point.
I, so, I was in my 40s. Like,
Mm-hmm.
you can't keep doing this. I was in my 40s. You need to be a nurse. So I had tons of credits because I had already went to school for, I had a, what did I have? I had an associate's in, I don't know, something, administration or something.
Mm-hmm.
So I had tons of credits. So I applied for school and I started taking all my nursing prereqs. And I started working in an emergency room, a very, very busy emergency room in New York City. It was like a level 2 trauma center, and I was an emergency room technician, and I really, really loved it. But again, my favorite thing was when folks would come into the emergency room to let them know, people would come into the emergency room for non-emergencies, right? It was their own health care. And I would say, we got this clinic, we have this program, you need to go to the dental clinic, you should go to the GYN clinic. Like, really, it was like always about health education, no matter where I worked. I ended up working in outpatient chemo. I worked on a step down floor as a nurse technician and chugging along with taking my prereqs. And then I hit a roadblock. I hit a roadblock, which is called anatomy and physiology.
It is a tough class.
I did microbiology, I did biology, I did human physiology. I could not pass A&P. I passed A&P 1. I had to take it twice. I got a C. I got counseled. Listen, you're not going to nursing school. You keep getting these C's. I would go to the guidance counselor. Then I took anatomy and physiology 2. Got an F in the lab. And I went to my... I don't know why. I was a great phlebotomist. I was a great emergency room technician. I would always get all these compliments from RNs that I worked with. And they would be like, you're great. You're going to be a great RN. And, I was literally teaching the new grads who would come to our job phlebotomy skills, EKG skills, all of those things. And I went to my guidance counselor crying. Like, I literally went crying, like, what am I going to do? And he said, you're not going to be a nurse because...
Okay.
You're not going to be, he was very harsh. He said, you're not going to be a registered nurse because you failed these 2 classes. You failed A&P 1, you failed A&P 2. You take it again. We're not going to pass you to the nursing school part. But you have all these credits. What are you going to do? So he said, let's take a look at everything. So he took a look at everything and he said, so I was taking a couple of psych classes because you needed them as prereqs. He said, how come you always get A+ in psych? I said, I don't know. He said, you get A+ in sociology. I said, I don't know. They're my favorite things. He said, what are some of your favorite things to do at the job? And I told him how I love to talk to people about health education. And he said, okay, this is what we're going to do. We don't want to take any more of your money, but the closest thing you are to, like, you're literally a few credits away from a psych degree. That's what you're doing. You're getting a psych degree. And then you're going to figure out from there what you want to do. What do you want to do? So I went along with his plan. And one of the things you had to do to get your psych degree at CUNY Medgar Evers was to take an experimental psychology class. And it was 4 credits. And you had to devise your own experiment, like, your psychology experiment. And what my professor, he was so great. He came up with this idea. We'll do a community health survey, the whole class. You'll go around and you'll survey folks. What kinds of questions do you want on the survey? So everyone input questions that they wanted on a survey that we would administer to college students, but they posed the questions towards what they wanted their project to be on. So my project was going to be on vaccine literacy, right? And so I put 3 questions. It was 100 questions, and everyone put questions about health and psychology and mental health on this survey that would meet their needs when they wanted, so they would have data for their own project. And then he had to approve our projects. I told him what I wanted to be my project on, and he said, fine. He went around to approve everyone's project. We got this survey, Qualtrics survey going on. We got IRB approval through the college, and
Mhm.
we administered the survey. So it was about 17 of us in the class, and we went around and we ended up getting about 450 students to answer this survey. And then we looked at all the data, we put it into SPSS, we got our data, right?
Mhm.
So now I can, one, my questions were, um, do vaccines cause autism?
Mm.
Are vaccines safe? Are vaccines helpful to the public? And
Mm.
so I took all of this, and while this was going on, there was a measles, mumps, rubella outbreak in New York City going on.
Mm.
Right? So I was asking these questions during a time where I really wanted to hear these answers. So I got my data, I did my project, found out that the folks that we asked these questions, the more education they had, the more likely they were to say that they didn't trust vaccines. So I had to write a paper about that. I was actually really, really shocked. And I guess it was during the era where a lot of things was going on in social media, talking to people about whether vaccines are safe, vaccines are not safe. This connection that had no empirical evidence, but this connection to there possibly being some connection to autism. And so I did find out that out of the participants that we surveyed, that the more education they had, and the more likely they were to be on social media, the more likely they were to believe that connection.
Mm.
So I wrote a paper about it. And, I was about to graduate, didn't know what I was going to do. My professor, who was a clinical psychologist, said, what are you going to do? You're going to, you're going to move on to your master's? Are you going to go into clinical psychology? And I said, no, I don't know what I want to do. He said, I'll tell you what I think you should do. And this was midway through the semester. He said, I feel like you can have a career in public health. And I said, what do you mean by that? He said, that's what I call you. Every time I'm grading your papers, I call you public health,
Mm.
because I feel like you're always come from a public health angle no matter what. And I also had him from abnormal psychology. And I
Mm.
did a paper about spanking and things like that. And he was like, I don't know, you just come from a public health perspective on everything that I've ever asked you to do. And I started looking into it. And so I
Mm.
started looking into it, and I said, you know what? I'm going to apply for graduate school. And that's what I did. I applied for the CUNY School of Public Health. 2 years later, I had my MPH. That professor was absolutely right. Would I have been a great RN? Probably,
Mm.
probably. But I am not mad. I am super happy at that professor seeing that in me and me finding my way to public health.
Yeah.
And now on my way to, applying for schools, I'm going to do this DRPH thing. But
Woohoo!
I'm going to do it. So, and a lot of people said, how are you going to get a job in public health?
Mm.
And I said, I'll do it. And I still could, I literally was working on my master's, still working on a step down floor. I was working on a thoracic surgery step down floor at a cancer hospital. So everyone who was my patient were folks who had smoking related cancers. And, there's an education piece in that too, as well, right?
Right.
So I said, I'm gonna get a job. And I applied for NYU as a community health representative in a study that, was really, it wasn't what I wanted to do. The study, although I did really become involved in the study, and I never had thought about something like this. It was a caregiver stress study, and it was a study measuring the stress of caregivers who take care of their loved ones who have some type of cognitive impairment due to aging, like Alzheimer's disease related dementias, things like that.
Right.
I actually ended up getting really involved, even though it wouldn't have been my first topic. Getting really, really involved, look, and then of course, me with my research brain, researching that how, Black folks in the United States have worse outcomes when it comes to Alzheimer's disease, and caregivers have more stress. Black caregivers have more stress. Family caregivers. They weren't talking about paid caregivers. They were talking about if, you're taking care of someone in your family. And so I was really into it, but I was always into the disparity part of it, right? The
Yeah.
health equity part of it. That was always, and that's something that my professor had saw in me. He saw that it's a health equity thing with you. It's always, and that's why I need you to go into public health. And I'm sure he's super proud of me when I saw
Aw.
him not too long ago, and I said, "Yep, applying for PhD programs. He was like, I cannot believe it.
Mm.
I can't believe it. Then people who see me now too, also like my former coworkers in nursing are like, I see you there, but I also can't believe that you didn't become a. So I'll stop there. So you, because I know you have like questions of my like crazy journey towards being a public health scientist. Ultimately, what my end game is to thinking I was going to be a registered nurse.
No, I think it's just a fascinating story. I think a few things that come to mind is one, having the right professors. And like you said, coming from starting in a place where women were not even encouraged to do much in school and then finally getting there. And it took years because, like you said, you're getting this bachelor's degrees now in your 40s. I mean, that's amazing. So it's one or two things, right? It took whatever 20 something years for people to get to this place where they were encouraging women to go to school and to achieve the highest, in school. And that's something unique that, you can talk about. I don't have that experience. By the time I was ready to go to school, everybody thought I was going to be a medical doctor,
Right.
and that's such a very unique thing. Like, and in those 20 years, like, you're just finding yourself, you're just going with the flow. That's very interesting.
And I'm happy that the journey I went that, because I'll tell you what, when I first went away to school, my mom was a bookkeeper for the Marriott Corporation. For her whole life, she was a bookkeeper. She did night auditing, and she was like, you'll do better than me, because every parent wants, that you'll get your degree in accounting, right? Because that's what I do. And I actually when I went, I didn't declare a major, but I started thinking when I first went away to college in that first year in 1989, yeah, I'm going to be an accountant like my mom said. And my stepdad was a computer science engineer. He was the precursor to what IT is now, right? Back in 89. So, I could have done that as well, but they literally were not telling girls this is something you can do. I remember I did take one course in accountancy, and my professor was a man, and he was just like, he wasn't really into the girls being in that class,
Mm,
he just really wasn't into it. I was expected, I was really good at writing. So I guess I thought, I'll take English literature. I don't know. I never knew what I wanted to do. I
mm,
certainly didn't know anyone at my whole high school who was going to school who said anything about, I think there was one girl, and I wonder where she's at now. She
mm,
said, I want to be a doctor. But no
mm,
one else, no girl in 1989 in my graduating class said, I'm going to be a doctor.
mm,
Not one of them. Maybe one. And now I have to look her up and see what she's doing now.
mm,
Did she become a doctor? And then, later on, when they started pushing women towards, nursing, and now you still, and even though they push women towards nursing, if you think about it, when you look at nursing management, you'll start to see that nursing management is being dominated by men in management in nursing, by male nurses. I was happy when I met someone like you, right?
mm,
I was happy when I said, you know what, this is where I'm going. I'm going where
mm.
she's going. And to see another Black woman face, and of course, where we work at, we see those faces. But
Right.
in general, I didn't see a lot prior to coming to NYU. I didn't see a lot. I didn't have a lot of mentors or peers who were in public health. Besides, when you go to school for public health, you do have a few mentors or peers, Black women who are in public health in graduate school, right? But you don't know how it's going to look when you get out there and you start
Yep.
working.
Yeah.
So, like meeting you and, meeting some of our other peers in the department that we work in, I was really, really happy to see that other Black women were going into public health as researchers and scientists. And so
Yeah.
I was happy with that.
No, and I think that's why I even want to talk to you because I think that, one, encouraging people who are older, you can still do it. There's no, this is a timeline. You are going for your freaking PhD. Well, Dr. PH, because for those who don't know, a Dr. PH is more of the practical application for those of us in public health, which by the way, it's so funny because I did psychology for my undergrad as well. That's my first degree, psych pre-med, and then public health or whatever. So I didn't even know. I think I forgot that it was psychology you ended up with your degree
Yep.
in.
I did a degree in psychology, and it works. It helps out. And but
Yes.
doesn't it help out so much in a public health career having that psychology basis. I'm really happy with my choice, and with the two people who the counselor,
Yeah.
the enrollment counselor, and my professor. If it wasn't for those two particular Black men who say, "Nope, you can do this," and they knew how old I was, they knew I was in my 40s. You can do this, and I also, anybody who's my age who says, "Should I get my master's? Should I go back?" I say, "Yup, do it." I'm always the one to say, "Do it,
Yeah.
do it."
Yeah, because I mean, to your point, it was 2 years, right? And the 2 years would have gone regardless,
The 2 years
right?
would have gone by regardless, right? And so, it was 2 years. It went by super fast to me. People were telling me, no one's going to accept you for a public health position. I said, no,
Mm.
I'm going to apply. I'm not going to keep applying for nursing support positions. I'm not getting this master's for nothing. I'm going to
Mhm.
keep applying for public health positions. And that's what I did. And it wasn't that long.
Yeah.
It wasn't that long. So I was still doing my master's. I think after I graduated with my bachelor's in psychology in June of 2019, and I started my first public health position in February of 2020.
Wow.
And what a time to start in public health.
Right?
Right? So I mean, I was a week in. I had already knew that COVID-19 was coming, because remember, I left January 3rd, the last day in January of 2020. I left an inpatient position. So there
Mm.
were already meetings, there were already talks in January that this COVID-19 is coming our way. I don't even
Mhm.
think they were calling it COVID-19 at the time, and we need to be prepared. So I already knew about its existence, but boy, did I, 2 weeks later, at my first job in public health, it was like, okay, this was a good career to choose.
Really?
Like, oh my God, I cannot believe this is happening. It was pretty scary times. And then, March 13th was the day for New Yorkers where the mayor came on the news, and the principal investigator that I used to work with said, pack up your computer. When you clock out, I don't know if you guys are coming back Monday. We're doing everything from home, because we were doing psychosocial surveys for caregivers who are taking care of folks with Alzheimer's disease, related dementias, other cognitive impairment. And we didn't want them coming into the office
Mm.
to do a survey that could be done over the phone and then
Right.
going back to take care of folks.
Yeah.
So, and we knew that day that we were going to pack up our computers and leave, and we didn't come back for months.
But look at how God works, because you could have been what they call like an essential worker if
I
you
would
were.
be an essential worker. And they turned the floor that I worked on was a step down floor for thoracic surgery. They literally turned it in and made everyone work. It ended up being a COVID ICU floor. So
Wow.
I would have been nursing support on a COVID ICU floor, and I would have been terrified. I'm not going to lie to you. I would have been terrified with my age,
Mm.
just being, I don't know. I just would have been terrified keeping myself safe
Mm.
from contracting COVID.
Mm.
But I also was like, what a career to go into.
Yeah.
Now I'm in public health, and this big public health emergency, the biggest public health emergency of my lifetime that I experienced as an adult. Of course I was around when I was younger, when, HIV, AIDS was a huge public health emergency, but I was a little girl. But
Mm.
this was like, I'm an adult and I'm in public health, and this emergency is going on while I decided to go into this this industry. So,
Yeah.
I thought to myself, wow, things work out the way they should work out,
Yeah.
because look where I'm at the
Yeah.
time that I'm at. And then there's no lack of public health positions now. And when I first went in, I was like, what will I do? Will I go work for the Department of Health? What will I do as this person with a master's in public health? But now, you know,
Yeah.
public health is here to stay, right?
Thank God for that. Thank God for that. We forever have jobs.
Right.
But no, yeah. Speaking of which, so now tell me why you then want to go for a PhD, because or Doctor PhD in this case. People have asked me that several times on the show, like, why
Yeah,
did I do a PhD?
people are like, why? You got your MPH, you got a good job. Why? I do want to be in a leadership role. I'm so passionate about it. I just felt like I can't stop. I have to go for this. I can't stop. I have to keep engaging myself, keep enlightening myself. I'm actually one of those people that like school. When people are like, "Do you?" I can't believe you're going back to school. I love academia.
Hmm.
actually love it. I like writing papers, but I also like, I think I want to make sure that I can keep going in this career that I love so much. And I have had people say, it's expensive. Why are you keep going? Why at your age? But I'm not dead. I'm still here.
Amen.
Always going. You always want to keep learning. Like, to me, life is about constantly learning and unlearning. Because you got to unlearn bad stuff, learn good stuff.
Yeah.
You're in this constant quest for, even in just your life, your
Yeah.
regular day-to-day life, why not keep learning if you want to?
Yeah.
And I do want to be in a leadership role. And of course, I want to be this. I absolutely want to keep going. I can imagine myself doing something in my community in Brooklyn, a public health intervention that will really help out folks in Brooklyn,
Mm.
particularly, all my cousins in the diaspora. When you think about where I'm from, where I
Yeah.
live, where I want to be, where I want to work at, it has to be Brooklyn.
Mm-hmm.
Where else is there Black people from all over the world
Yeah.
but Brooklyn? So I
No.
want to do something for my community, and to do that, I really do feel like that I need the DRPH.
No, I love that. And I think it's very important because that was my reason as well, even though I don't want to write papers. So, kudos to you for loving to
I
write
love
papers.
writing papers. You don't want to.
Like, everybody knows that about me. I am not the one who's writing papers. I'm sorry. I want to lead. I'm a very good leader, naturally. But I'm,
Oh, public health leadership, you got that.
thank you.
I
But
actually love writing papers.
but no to the papers. But no, and I think what the point that you're making of being in this leadership position is also very helpful, especially if you go to academia. Even though I don't really see you in academia, but if you do go to academia, just because imagine being able to tell everybody, like I can imagine you saying this on the first day of class every semester, and just kind of saying your story
Yeah.
and just being able to engage people that way, because then they can know that they can go for this, and then they can, learn and unlearn, and they can become who they need to become, especially Black women, because like you said, even now, even at our job where we are seeing a lot of it,
Mhm.
we're still few. I still go to places where I'm the only Black girl. In fact,
Mhm.
in our entire project,
Right.
I mean, we can count how many people, for example, when we go into the room, are
Right.
Black people,
Right.
and more especially Black women. And that's so
Especially Black women.
important.
Especially Black women. And here's another thing too. Even when I go to conferences, when I went to the last conference I was at, I went around and there were, I don't know, 200 posters lined up in a ballroom, and seven, seven were had Black women who were authors and co-authors.
Mm,
Seven.
mm,
So I was, yeah. And I also want to tell, I know there's, the nursing field is very provocative. Like, folks want to go into nursing for the just for the passion, for the money, for a lot of things.
mm.
But I also like to tell Black girls and young Black women, you can also go into another health profession besides nursing
Mhm.
and still help out, and you can still have that passion and that fire for health
Yeah.
that's not necessarily nursing.
Yeah. No, I think it's very important. I've had the opportunity to talk to a lot of young people, and I always tell them to get their first degree in public health or psychology. I mean, you can go on and ahead and go, get your nursing eventually. But like you said, one of the few things is you learn a broader scope of health, even, right? Like, I feel like I know even some things that nurses and doctors don't, because sometimes you're
Right.
pigeonholed into your field, whereas we get the opportunity to learn across different fields and across different professions, because we end up working with so many other people, even in that field of public health.
Right. Like, we work with physician scientists
Yes.
and registered nurses who are now, public health scientists. But another thing is, I always think about this whenever I go to the hospital, or I go to the doctor, or I go to my primary care provider, or any health related things. And if a doctor asks me, and they ask me all the time, well, what do you do? And I tell them, sometimes I have to imagine me explaining social determinants of health to a
Hmm.
physician, right? To a physician.
Yeah.
talking about, they're always so fascinated when I talk about, hypertension prevention in barbershops and,
Right.
into public health interventions. And they're always so fascinated. And I'm talking to a physician, right?
Yeah.
Who, and so I like having that knowledge. I'm not a physician, but I do like having that knowledge. And
Yeah.
also talking to all of my friends who are RNs and telling them about, these, interventions and these prevention studies and things that we do. And they're always so fascinated. And it also makes them, I love when I see a registered nurse get an MPH or a
Mm-hmm.
doctor get an
Mm-hmm.
MPH. I
Mm-hmm.
love that.
Yeah.
Because I mean, what better doctor are you when you understand public health?
Yeah, I made both my best friends get public health degrees. My best friend is a ENT surgeon and he has a MPH, and my other best friend is an RN and she has an MPH as well. So
Love it.
yeah,
Love
I
that.
know.
I have a friend that's a social worker, and I made her get a public health degree.
Yeah,
I said, "Get a
absolutely.
master's in public." She's like, "I have a master's in social work." I said, "Get another one."
Mm-hmm. Mm-hmm.
But
Yeah,
you'll be a good social worker if you
absolutely.
understand public health. Yeah.
Absolutely. But no, I think I want to ask you this question on community engagement because, again, you're very passionate about your community. And obviously, it also then, like, the story that you've told us, you see that thread come out even just in your personal life. But
Mhm.
what is community engagement to you? And not just from the healthcare perspective, because I think there's an importance in that, but like how you say you're Brooklynite. Is that what it is? Like,
I'm Brooklynite.
what does that mean? What does that look like? What does that look like as far as like, because when I think about the difference between Brooklyn and the South, and maybe it's just because of stories, because obviously I'm not from the US, but
Mhm.
I think of the South as people who know their neighbors, like
Mhm.
who, grew up with their neighbors, and, there's that we all look out for each other. But I don't think of Brooklyn in that sense. So what do you see?
I think people who live in Brooklyn and even people who grew up in New York City, and I'll start from when I was little. I grew up on a block of brownstones before we left for Atlanta, and even every summer that I came up, and I still have that community. So I grew up on a block of brownstones. Across the street from me were tenement buildings, walk up buildings that were, 4 stories high sometimes. And then down the street were housing projects. But then my grandmother had a house and we lived on a block with house. I knew everyone. My grandmother
Mm,
knew everyone on that block. I knew the girls that lived in the housing projects. I knew the girls that lived across the street. My grandmother knew all her neighbors. And a lot of people don't know that about Brooklyn. You know your neighbors. When I became older and I moved to Crown Heights, and I've been in Crown Heights for 20 years, there's nobody in my neighborhood that I don't know. I know
mm,
the pharmacy on the corner. I know the guy that owns the beef patty shop. I know the laundromat. When I go get my hair done, I'm always talking about health interventions.
mm,
Everybody in the hair salon is like, "Oh, I didn't know that." I remember one time I went to the hair salon and one of my friends was talking. She was like, "Oh, they asked." I was at the doctor and they asked me, "Should my daughter get the HPV vaccine?" Then I started telling her. She's like, "What do you know about it?" I said, "Well, I know a lot about it." So I started telling her about it. I said, "Actually, my son has had the entire series." She was like, "Why would you get it for your son?" So I ended up doing this whole education piece: what HPV is, how it
mm.
causes cervical cancer, talking about the vaccine, and I literally ended up. I'm in the hair salon. We're all under the dryer. Yeah, and I ended up giving like this health promotion fair.
Yeah.
So everyone knows me for that. The building that I live in is sort of a naturally occurring retirement community. It was
Mm,
built in 1975. People who came here in 1975 still love their large apartments with balconies and they haven't left. And I could literally be downstairs in the laundry room, talking to seniors down there like, "Hey, make sure you get your flu vaccine, make sure you're getting checkups, make sure you're getting checked for colorectal cancer." We do have community. There's nothing you don't know. If something happens down the street, I'm going to hear about it.
mm.
I'm going to hear about it within 30 minutes. "Oh, you know what happened down the street? There was a pipe that burst in this building." There are really small communities in Brooklyn.
Okay.
Like if I go 5 blocks over, I don't really know those people, right? But
Yeah.
I know my 4 block radius and everyone knows me. When I moved into this building, I moved from a block away. And when I moved in, everyone was like, "Oh, you're the girl from Carroll Street with the really, really quiet son." So it's just like each community in Brooklyn Folks from Flatbush, no folks from Flatbush. Folks from
Mm.
Canarsie, no folks from Canarsie. There are really communities in
Okay.
Brooklyn. And people don't I think if you don't live in Brooklyn, or if you're just here for, I don't know, a 2-year rental, you would
Mm.
never know that. But there are real communities in Brooklyn. And it's only 6 degrees of separation. If you grow up in Brooklyn and you're a certain age, I'm Gen X in Brooklyn. I probably know everyone Gen X in Brooklyn. If I don't know
Mm.
someone, I know someone who knows someone.
Yeah.
So even though so Brooklyn has the largest concentration of African Americans in the United States,
Mm.
in a couple of square miles. I forgot what the latest number was. It used to be 1 million, but it has gotten lower. There's about 800,000 Black people who live in Brooklyn, in this small concentration. So there
Mm.
are other cities in the United States that have tons of Black people, right? But not 800,000 Black people
Yeah.
in the same square miles. So it's a huge city. And even with 800,000 Black people, it is a community. And it's a
Mm.
different community than other communities. If you go to Jamaica, Queens, where there's a good concentration of Black folks, they will say that they're their own community. If
Mm.
the Black people in Staten Island, they will say that their own community. As huge as New York City is, Black folks really do have community in New York City. It's really helpful to me, and I explain that to people because I have friends. I went to school down south, right?
Yeah.
Friends always ask me. They see me on social media. Oh, you went to the party? I was like, yeah, that's my friend of a friend of a friend that got married. Gen
Mhm.
X Brooklyn is very close, actually. We all know each other. We really all know each other. So that's what I mean by community. And when I look at Central Brooklyn and North Brooklyn, which is where I'm from, Central Brooklyn, when you look at the city's community health profile, that there needs to be work done in Brooklyn for Black folks. I mean, when we talk about, we talk about diabetes and hypertension and Black maternal health and things like that. There's so much work to be done in our community. There's not a loss of work to be done here. And it really, really is a big, small community.
Yeah. No, I love that. I think I was thinking, the reason why I asked you that question is because as an immigrant, obviously, and I shouldn't use myself, I've just moved around a lot, but like, it takes time to be a part of community, right? And we see how much gentrification is happening, changes are happening, and all that. So I was going to connect that to how you then promote health equity and promote health education and health awareness even in the community, because I think what I think is important is having someone who's from the community so you can speak to the community a little bit different from how I will be able to speak to the community. It's helpful that I'm Black. It's helpful that I'm, an immigrant maybe in some way. So, there's conversations to be had. But in health equity and just in public health in general, we're not seeing a lot of people our color who are in public health. So how do we do the work in your kind of community, for
Right.
example?
Well, we do the work by getting our DRPH, right? So we can be in these leadership roles, right? So we can be in these leadership roles. I remember when I first came back to New York, and I was a young adult, and back then there was no Affordable Care Act and things like that, and lots of jobs weren't providing insurance, and I was underinsured, right? Even though I had admin jobs until I got a job with a big company like MetLife and the New York Blood Center and things like that. But prior to that, I was underinsured. And I used to go to a community federally qualified health center called Brooklyn Medical Plaza. And I got some of the best medical care there, right? And they used to always have workshops, and I got my teeth cleaned there. I got my GYN exams there. And I thought about, this is really a staple in the community, right? They're a federally
Mm.
qualified health center. The director was Black. I really looked up to this. Like, I knew I could go there and get health care. And, they would have festivals and they would have health fairs and things like that. And I always thought about that when I thought about where I'm going to in health, right? And I think about like the engagement they had in the community, handing out flyers, letting you know if you don't have insurance that you're welcome there, making sure. I would go there for a regular checkup and they would be like, hey, when's the last time you had your teeth cleaned? Go upstairs and have your teeth cleaned, which, to be honest with you, that was the best dentist that I've ever had. I've had a hard time finding a dentist as great as this dentist who was in a federally qualified health center. And so when
Mm.
I think about community, I think about things like that for us, access, right? There was hard to get appointments. It was always backed up. was always a ton of waiting time. And that goes to show you how much that place, and it's still there. It's Brooklyn Medical Plaza is still there. How
Mm.
much it was needed in our community, and how we needed more than one,
Yeah.
right? More than one.
Yeah.
So I think about things like that, and I think about how I'm going to show up in my community as this public health educator, this public health scientist. Those are the kinds of things that I want to show up in my community as.
Yeah, no, I think that's awesome. And I think that the for people who are listening, it's one, think through how whatever it is that you're doing helps your community, helps, just and I like the idea of essential place. For a lot of us, especially Nigerians, it's usually a place of worship, so like church or like mosque or whatever. But I kind of like what you're saying about this idea of a federally qualified healthcare center that also, is community based and community driven. And I think that if we do have a good community driven mindset, we can really impact. And it's not just healthcare. I think that's what I'm trying to say. Like, it's not just healthcare. We need to start to think broader as far as like the impact that we're leaving on earth. Okay. All right.
Yes,
That's it as far as like the hard questions. It wasn't really hard, but I really just wanted you to share your story to encourage anybody who's listening, no matter your age, no matter where you are, go for whatever it is that you want. And I think, again, remembering that, listen to wise counsel, right?
right.
um, you were fortunate to have it, but if for us, like, pray for wise counsel, because there's nothing like it in helping with the direction of your life. That's definitely awesome. But I did want to talk about the Usher concert. So let me tell you, Miss Tanisha, she told you she's at 53 in 2 weeks, but she's the most fun. She's always out there having fun, like living her best life. Last year she was at the Usher concert. I just want you to know, like, I won't say that you were doing bad things. You were doing good
I
things.
was I was pretty tame, and I grew up on good R&B. Usher is a few years younger than me, but he's in older
Mhm.
millennial, early Gen X like I am. And I grew up on good R&B, and I wanted to, like, I got to get away. Sometimes I need to get a break, and I was really really happy to go to a great concert. And any good R&B concerts that are coming up, the one thing that I want to see before I leave this earth is I need to see Anita Baker in concert.
Oh, nice.
Michael Jackson in concert 3 times from when
Oh,
I was a
wow.
little girl. And then when I was
Just
a teenager, I never got to see Whitney Houston in concert.
me too. I know.
And that is very, very sad. I've seen
Me
New
too.
Edition more times than I can remember.
Mm,
But Usher was a big one for me. That was a
yeah.
big one for me. I mean, it can't top seeing Michael Jackson in concert, but it was a big one for me. I love a good R&B concert, and I had a great time out in Las Vegas.
What
A
was
great
that? Well, it was your birthday too, right? Oh, it was just
It was not my birthday. It was one of my friend's birthday. She was turning
okay.
45, and
Hmm.
we were like, yes, we're mothers, and we're professionals. But was in his 40s, put on a
Hmm.
great show. Was obviously in better shape than me and she were. She and I were. We left that concert limping, and we slept all day the next day.
I love it. I love it, and I bring it up to say, live your best life, guys. Live your best, whatever works for you, whatever makes you happy. I really, really love it. Thank you so much for doing this with me. You get to ask me one question on anything. So yeah, one question.
I get to ask you one question on anything. Oh, what your parents wanted you to be.
Hmm.
What did you think? Did you see yourself in this position at your age? Or did you, when you were a little girl, what did you think you would be doing right now?
Honestly, I don't know that I know anything about my little girl dreams because I feel like my parents had told me I was going to be a doctor.
Okay.
So that was it.
All right.
Hey, hey. But I think that as I started to grow older, I was okay with it. Even though I wasn't doing too well in science, I was a little worried. But I had other things that I wanted to do. I don't know, for some reason I've always had this dream to own a school, and my school is going to be non-traditional in the sense that it would have those who want to go to school, just the actual middle school, high school, but then have a focus on people who may want to go the vocational route or who want to go sports route, or who want to go music route. So that and being the Minister of Health were the two things I remember writing as a teenager that I wanted to be able to accomplish. Oh, and writing, but non-academic writing, be an author.
But
I'm
not
like,
abstracts, right? Not manuscripts,
not,
not
not,
scientific papers.
not scientific
I
papers,
love.
just thought pieces, novels, romantic novels, especially. I don't know. I'm still so hooked on romantic novels. Not now in reading them, but like in wanting to write them, kind of thing. So those are the three things that as a teenager I settled on and I thought I was gonna do. And I still feel like in some ways those are things are dreams that are still going to come through. Like we did the doctor part, now I just need to do the other two parts in
I see
different
Minister
ways.
of Health in your future. I do see Minister of Health in your future.
Thank you. Thank you. No, this is awesome. Thank you so much. And I really know that people are going to be blessed. Thank you, Mr. Nisha.
Thank you for having me.
Thank you for joining me on today's episode. Just like you would share with friends about a great book you read, don't forget to share this if you enjoyed it. Connect with us on IG and Twitter at TWWPcast and get details on the website at worldwithoutpeople.org. And hey, remember to make loving others the story of your life. Until next time, this is the world without people.